Welcome back. What I'd like to do now is what we've really done since this pandemic started and get the perspective from those in the front lines, because I think for many, there's a presumption that with the worst behind us, everything has slowed down, including scenes in the emergency rooms, and particularly in New York, that is not the case. Let's bring in our guest right now, Dr. Stefan Flores. He is an ER doctor at New York Presbyterian Columbia University Medical Center. Doctor, first off, I think there's a perspective, and I believe it to be a very faulty one, that yes, we've hit a plateau and maybe we're starting to get on the right end of the curve, but it's not like the folks in the front lines aren't still seeing, huge demand right now in the ICUs, and there still are not acute cases that you guys are dealing with. We see it from the daily fatalities, but more so, things have not yet broken the way that I think the general perspective would like to believe.
Right. I think you hit it on the nose. So we are in plateau right now, which means obviously we're still seeing high acuity. So sick people that are coming into the hospital or that are still remaining in the hospital, like you said, in the ICU. But the volume, the actual number of new cases that are coming into the hospital is definitely a lot less than what we were seeing from even a week or a week and a half ago, I can tell you, which again is a good sign. But again, we need to interpret all those things with caution. Every piece of data that's obviously coming out there, considering that obviously this is still going to last for days, weeks, months. And a lot of those patients that are in the ICU that are still in the hospital, they've been in the hospital for some time because they're critically ill. So again, I really urge everyone to obviously really take caution when they actually hear the numbers, considering we're going to still see obviously case fatalities going up. And we're going to see it obviously in these vulnerable populations. As you've seen, there's been outbreaks in nursing homes and other places where people can't isolate and do usual social distancing measures that probably the general public could do.
And I want to get to some of those mitigation factors and for somebody in the front lines, your perspective on them. But there's so much about this virus that everything we were told a couple months ago, some have held, but some haven't. We're learning right now, doctor, that people that may have tested positive for this 30 days ago are still testing positive in certain cases. Obviously, it's not just the elderly and those with pre-existing conditions that are vulnerable. What has surprised you and your colleagues about this virus now compared to, say, at the beginning of the year?
Yeah, so I think as far as testing goes and as far as kind of the first part of your question, it's a little difficult because we're learning this on the fly. So obviously we don't have a lot of evidence or science to go by as far as other diseases, for example, heart disease, a heart attack, stroke, etc. So the medical community is kind of putting all their heads together, not only within the country, but across the globe to kind of figure out therapeutics, vaccines, clinical presentations, pretty much anything and everything in regards to the virus itself. As far as, like you said, patients testing positive initially and then testing positive later on, it's hard to really say. It depends on the type of test. But until we get more widespread testing, it's going to be really hard to say at this point in time.
To that end, doctor, and I'm not dragging into the politics of all this, but obviously testing is the next big national challenge that we have to solve, whether it's federally, state, or some combination thereof. But nonetheless, answer to the person at home who says, oh, you know what, I just want to get back to the way it was. Why do we have to worry about testing here unless I'm sick, and if I'm sick, then I'll get treatment? Explain why testing goes hand in hand with what you're dealing with on the front lines. And if you don't have it and we release people too early, we could find ourselves in the same situation all over again.
Right. So that's exactly it. So the reasons why some places have been so effective in other countries has due to widespread testing, essentially, kind of like you mentioned. So with coronavirus, there's obviously a 2-week period from when you're initially down or when you're initially infected with symptoms, where there's an asymptomatic or latent period or silent period where you don't know that you're infected, to obviously when you actually have symptoms or when you present to the hospital and then actually warrant testing. So there's a long period, like you said, about 10 to 16 days where that happens. So a lot of people, obviously, and this is why initially we had such high levels of the disease and we didn't know because they were walking around and they had corona, but again, there was no testing. So that's why testing is so important during this time. So we can isolate and trace and really figure out who's sick and who's not. And this is also going to be even more important when we talk about reopening the economy. And that needs to occur not only from individual hospitals, we have to work in unison with healthcare, with private sector, and with government. So it's going to take a unified approach for us to do that and really get back to a sense of normalcy here.
And for me, and I'll just throw this in, the idea that we'd have the situation like with the ventilators play out where state fights other states for the same piece of equipment. That's why the federal government, whether they want to or not, have to have an involvement, especially with the tracing component to this. To that end, I have family who've been involved and been around the hospitals every day, and the exhaustion from every ER doc or people that spend in the ICU, and that goes to the RNs and all the other support staff you have. The fear I have beyond just the normal health concerns are, God forbid, we have a second spike in June or July because we go out too early and we're not prepared for this. I don't believe, and you're closer than I'll ever be to it, Doctor, that you guys can just re-engage on the scale that you've had to for the first few months of this year, go right back to it as early as a couple months from now. You guys need to have some gap, both from a prep standpoint, but even from a physical and emotional standpoint before you have to get right back into it, I would imagine, all over again.
I think you hit it on the nose. So it's exactly it. So we already obviously are operating beyond maximum capacity. I could tell you even in New York City and New York State, that was happening before the pandemic hit. Now you superimpose this pandemic, and I mean, it's a recipe for disaster, right? So the same thing that's happening to patients when they suffer from coronavirus, where they suffocate and die, is what's happening to our U.S. healthcare system. So like I said, this pandemic is really kind of affecting everyone, as you said. I mean, healthcare workers are feeling the sense of PTSD, and obviously we're overburdened considering everything that we're dealing with at this point in time. And yes, we are all concerned, and I can tell you all of my colleagues, not only emergency physicians, but all of the healthcare workforce, of that second surge if we don't obviously take the appropriate measures and we don't act too hastily.
Finally, Doctor, before I let you go, on a positive note out of all this sadness, every Sunday, every 7 o'clock, it must be nice. Fire engines firing up their sirens, people banging on pots and pans, saying a well-deserved thank you to all you guys, what you're doing. And I see when you discharge patients, in the beginning there weren't that many wins, but you're getting more and more wins. Is it nice at least that the public appreciates what you guys are going through, or at least a lot of them, and also that you're starting to see more victories?
Yeah, I think it is nice. None of us, I think, signed up for this. It's an extreme version of the Hippocratic Oath, so to speak, but it's why we're here, and it does validate why we go into medicine. And it does, no hope for humanity is lost at this point, so I do appreciate that. And there has been a lot of really, really nice things that have come out of this, and people have really stepped up to the plate. And I applaud, not only the public, our general leadership, and other people who have really taken the reins during this time. So.
Well, Doctor, I'm sure that you give it all up here if you wouldn't see as many patients and as much unfortunate sadness as you've had to encounter. But I speak for our audience, appreciate everything you and your colleagues are doing. Thank you so much.
Thank you for having me. Appreciate it.
We're going to take a quick break, but when we come back, we're going to close tonight's show out with some moving images from the week that was.